the osteology of head and neck with the skull bones. So let's have a glance at the most basic things we must know. The skull bones can be divided into two, the calvaria or brain case and the facial skeleton. Coming to the calvaria, we have 8 bones, 2 paired and 4 unpaired. The paired bones are parietal and temporal bones, whereas the unpaired bones are frontal, occipital, sphenoid and ethmoid bones. We have 14 bones in the facial skeleton, 6 paired and 2 unpaired. The paired bones are maxilla, zygomatic, nasal, lacrimal, palatine and inferior nasal concave. The mandible and vomer are the 2 unpaired bones of facial skeleton. So let's see the bones. This is the lateral view of the skull. Here we have frontal bone, lacrimal bone, nasal, ethmoid, zygomatic, maxilla, mandible, sphenoid, temporal, occipital and parietal bone. And when we turn into the anterior view of the skull, we have the vomer and the inferior nasal concave. Now, let's see the sutures of the skull, which connects the bones of the skull. We have coronal, sagittal, lambdoid and metopic sutures. Coronal suture present between the frontal bone and 2 parietal bones, whereas sagittal suture present between 2 parietal lobes. The lambdoid suture is present between the occipital and 2 parietal bones. The metopic suture separates the 2 halves of the frontal bone and it is present only in 3 to 8% individuals. Next we have 2 important points on the skull. They are brecma and lambda. Brecma is the meeting point between the coronal and sagittal sutures. Lambda is the meeting point between the sagittal and lambdoid sutures. In this diagram, we can see 2 more points. The parietal foramen on either side of the sagittal suture at the posterior aspect of parietal bone and the oblivion between the 2 parietal foramens. We can also see the vomian bones along the lambdoid suture. They are abnormal ossicles that develop from extra ossification centers within the cranium. Here we see is the vertex, the highest point on the sagittal suture. Next one is the pterion, which is the area in the temporal fossa where 4 bones, that is frontal bone, parietal bone, temporal and sphenoid bone joins to form an H-shaped suture. The anterior branch of middle meningeal artery, middle meningeal vein and lateral sulcus of cerebral hemisphere lies deep to the pterion. And here we have the asterion. It is the meeting point of parieto-mastoid, occipito-mastoid and lambdoid sutures. Moving on to the fetal skull, there are 4 fontanelles in a developing fetal skull. Anterior fontanelle, posterior fontanelle, sphenoid fontanelle and mastoid fontanelle. The anterior fontanelle is a diamond-shaped membrane-filled space between the frontal and 2 parietal bones. It closes around 8 months after birth, after which it will be known as brecma. This is the posterior fontanelle between the occipital and 2 parietal bones, which corresponds to the lambda after its closure. Here we see is the sphenoid fontanelle between the sphenoid and parietal bones. And finally we have mastoid fontanelle between the temporal, occipital and parietal bones, which is the future asterion. So that's all for today. Let's wind up here. Thank you.